Hello, everyone, and welcome to today's episode of Let's Talk About Perinatal Mental Health. I'm Julie. I'm joined by Lauren, a midwife and perinatal mental health specialist whose passion about helping parents navigate pregnancy and early parenthood with confidence and compassion. This is really a thing that I feel very passionate about. I reckon I had 2 episodes in my pregnancies. I had 5 pregnancies that really did bring to the forefront some mental health problems that I'd suppressed for a long time.
Mm.
So, Lauren, thank you so much for being here.
Thank you, Julie. It's lovely to be here. I think this is such an important conversation to have because so often we think about pregnancy and new parenthood. The focus is only on the physical health, the scans, the checkups, the baby clothes, but emotional well-being can sometimes be overlooked.
Yes, absolutely. That's still a lot of silence around how parents actually feel during the pregnancy and after the birth. The problem is you get pregnant and it's all about the baby. It's all about, are you having a healthy baby? Is everything all right with the baby?
Mm.
And actually, deep down, the mother is going through a bit of turmoil. There's things happening to her body that she doesn't understand, and it's just overwhelming. And I think it's so important that we are bringing this service to Dubai.
Mm. Yeah, there really is. The truth is, emotional health during this period is what we call perinatal mental health. It's just as important as physical health. So, perinatal refers to the time during our pregnancy, the first year after birth, and it's a huge change hormonally, physically, and emotionally. So, we now know from research, including NHS and NICE data, that around 1 in 5 women experience mental health condition during this time. So that includes depression, anxiety, post traumatic stress, less commonly psychosis.
And that is a significant number, 1 in 5. Absolutely. So that means, so we do free antenatal classes, which are really well attended. And to think that we have 40 women in a room, 1 of 5 of them women
Mhm.
are suffering in silence.
Mhm. It really is a huge number. And those are just the cases that we know about. So many women go undiagnosed because parents often feel ashamed, afraid to speak up. So it's so important to recognize that it's not just mothers, but partners and fathers can struggle too. Um, they may often fly under the radar even more.
So, why is it so crucial to pay attention to mental health during this period? I think the ladies need to know
Mm,
why it's so important.
mm. Because it affects everything. When someone is struggling emotionally, it can impact how they bond with their baby, how they respond to their baby's needs, how confident they feel as a parent. So, untreated perinatal depression or anxiety can influence the baby's emotional and cognitive development, not only because of a lack of love, but chronic stress affects how our brains and bodies develop and respond to one another. The World Health Organization actually highlights maternal mental health as a global health priority, but it shapes not only a mother's well-being, but long-term health and development of your child.
That's really powerful. And when I used to work at Sure Start, I used to run a class called Here's Looking at You.
Mm.
And we used to video mothers bonding with the child. And you could see by the video what mums had mental health issues and they didn't even know. Because one thing they didn't do with the child is make eye contact.
Mm.
And then the child doesn't develop or reach its milestones in a social way. And this is where we get people with autism on the spectrum. It's because they've not had that eye to eye contact. It's really powerful. It's not just about feeling okay in the moment, it's about seeing the foundation for the whole family's well-being.
Exactly. And here's something a lot of people don't realize, that if perinatal depression or anxiety isn't identified and supported early, symptoms can persist for years. So there's research showing that some women, depression can last up to 4 years postpartum if left untreated. And that means that mothers and families can be struggling a lot long after the world assumes that they've got it all together.
Which is really important.
Mm.
I
Yeah.
mean, and a lot of mums struggle in silence. So they put it down to tiredness, the fact that they're anxious about going back to work, and they don't know what to do about the feeding. They put it down to all different things when actually they're not okay.
Mm,
And it's all right to be not okay.
mm,
It doesn't make you a bad mother.
mm.
It means that you absolutely want to be the best mother possible. And it's really important that you seek help.
Exactly. And that's why there's screening. So when we talk about screening, we're not talking about a diagnosis. It's more like an early warning system to identify perhaps if someone might need a bit more support or a follow up. So in the UK, for example, we've got our nice guidelines, and they recommend that healthcare professionals, such as midwives, should screen for emotional well-being at key points during the pregnancy and after birth. So there's tools like the Edinburgh Postnatal Depression Scale, otherwise known as the EPDS, the GAD-7, and Hooley questions. So these were developed to help us midwives and doctors to start sensitive conversations about mental health in a structured way.
And we are going to follow the Edinburgh method because we've looked at all the methods, me and you, Lauren, and we've decided that's the best method for for we just think it's the best method for women.
Mm.
And it resonates with the fact that you're in Dubai, you're away from your family, and it's a more comprehensive method. And that's why we've chose it to bring to Dubai. So it's not just about filling out forms, is it?
No, exactly that. So the form is a doorway. So the EPDS, for instance, was developed back in the 1980s in Edinburgh, hence the name, to help identify symptoms of postnatal depression. And it asks 10 questions about mood, anxiety, how someone has been feeling recently. And it's been adapted for use during pregnancy, because we know that the issues don't just start after the baby arrives. So the GAD-7 looks at symptoms of anxiety, which are just as common but often go unnoticed. And the Hooley questions are two very simple questions, and they help to pick up early signs of mood or loss of interest in daily life. And the goal is to open up real conversations. The paper doesn't matter, the person does. And the bigger question, understanding each woman's story.
Because we're all unique and we're all very, very different. And what bothers one woman doesn't bother the other woman. So this is a very personal journey. And when you've got anxiety and mental health issues, it is really, really individual to you.
Mm.
So an anxiety can look different for lots of people. It's not the same, is it, Lauren?
No, absolutely, that's correct. Every woman brings her own story into pregnancy, and her mental health isn't just shaped by one thing, but it's a combination of influences, such as biological factors. So these can include hormonal changes, a personal history of family or family history of depression and anxiety, for instance, thyroid or autoimmune diseases, or even complications in previous pregnancies. For instance, psychological factors can include trauma, past loss, or stressors like fertility complications, challenges, and birth trauma. So then we also take into account environmental factors. These are huge. They're things like financial pressure, lack of social support, moving away from family, relationship strain, or living through global stressors like a pandemic, which are all relevant to us.
That makes so much sense, Lauren. It's like joining the dots between a person's experience and their current well-being.
Understanding this context is what allows healthcare providers to tailor support. So it's not only about the score you get on a questionnaire, it's about what's happening in your life and how we can help for you to navigate it.
And people need to navigate it with a lot of support, don't they, Lauren? This is something you can't navigate on your own. And this makes so much sense to me personally. It's like joining the dots between person's experience and their current well-being,
Mhm.
which is so important.
Exactly. And we know when we do that, we not only identify who might need extra support, we also build awareness because sometimes it's just realizing I'm higher risk and that's okay. That can empower women to seek help early and the impact of stigma.
So let's talk about stigma a bit more, Lauren, because even with all the progress we've made and the fact that there's so much out there about mental health and everything else, still, as human beings, we find it so difficult to say, do you know what? I'm struggling.
Mm. You're so right. Julie, stigma is one of the biggest barriers to seeking help. And so many women believe that saying they're not coping means they're failing as a mother. There's a powerful cultural narrative that motherhood should be the happiest time of your life. And if it's not, something must be wrong with you. But we know the truth is, it's normal to find that this transition is challenging. And as identity shifts, as hormones fluctuate, sleep disappears, the whole world changes overnight.
And it really does. I've struggled with all mine as newborns
Yeah.
because the sleep deprivation is on a different level. And the fear that your baby's going to die is overwhelming. And when I've spoke to women, because my journey, I wasn't a midwife when I became a mum, so I didn't know anything. I was just like the new mums now, okay? And you have an overwhelming responsibility that makes you want to run away actually, because you've never ever been responsible like you are responsible for a child. And it soon hits the woman very quickly that actually they are responsible. And even though the men are there, they're very supportive and everything, but the overwhelming responsibility the woman feels is on a different level, Lauren. And it's such a huge life transformation. I mean, it's wonderful when things settle down, but you have a period of adjustment that is mind blowing.
Exactly. We often underestimate depression and anxiety during pregnancy and after birth, and that they're common and treatable. They're not character flaws or a sign of weakness. What's heartbreaking is when these conditions go unrecognized and untreated. And that's where they can persist for years and make motherhood feel like a constant uphill climb.
And it can ruin relationships. It can affect the family unit for the rest of its life. And a lot of men don't know how to cope with it. So, what it does, it puts a wedge between the couple, and then they could see no way forward. And actually, it doesn't need to be
Mm,
like that
mm,
because, there's a old saying, isn't it? Men are from Mars, women are from Venus. So we all cope with things differently.
mhm.
And when a woman is feeling that she's struggling, it can come out in different ways. And obviously, you love your partner, and it can come out quite aggressive sometimes. And then that can cause problems that don't need to be caused. And that's so important that mothers can talk to somebody openly and honestly, just knowing that they're not alone. in feeling this way. And actually, half of what they're feeling is probably really normal with such a huge life event.
Absolutely. So, talking about this openly with a midwife or a friend, having peer support, or even through podcasts like this, it helps to break that silence, and we move to a place where we normalize it and we take the power away from that stigma and recognizing when it's time to seek help.
So, Lauren, recognizing signs and when to seek help is really, really important. And that comes with education.
Mm.
And we're going to do a lot at British Care because this is something we feel very passionate about. So, what are some of the signs that you would look out for as a specialist in themselves or their partners that might suggest they need some extra help? Because I know we're focusing in here entirely on the woman, but actually, some men really struggle with becoming a parent.
Mhm.
So, what are the signs that we need to be looking out for and what they need to be looking out for in each other?
So that's a really good point because it's not one size that fits all. As we know, everyone is an individual and should be treated as so. But there are definitely a few common things that we look out for. Some of those things include persistent sadness or tearfulness that's extending beyond a 2 week period, feeling constantly anxious or irritable, or feeling completely overwhelmed. Um, there's a loss of interest or little pleasure in doing things that you used to enjoy and take enjoyment from. And there'll be a difficulty in bonding with your baby, and sometimes feeling a little detached. There's trouble sleeping, even when the baby is asleep. And definitely there's racing thoughts or feelings of guilt, fear, feeling as if you're not good enough. And sometimes it's not obvious sadness. It might be displayed as anger, or there's a numbness or an over busyness, so where you're constantly trying to do things to distract yourself, um, and to stop you from feeling, essentially. If any of these signs last more than 2 weeks or interfere with daily life, then it's the time to reach out. Come to us at British Care, speak to a midwife, speak to me. There's help available and you don't need to go through it alone.
I find here that because we live in a world now that's completely different, and especially here where everybody's Instagram mad, people are getting a very distorted view of motherhood, and they look at this lovely family, the perfect family, and because they're feeling so down, they don't think logically that that's a minute that has been rehearsed. That is not reality. And it can then make you feel even worse that you're failing, but because you think that is
Mm,
reality, but it's not. And I think people need to be reminded of that and have a check in that this is not reality.
mm,
This is made up and it looks good for the camera, but actually, that family might be struggling. You're only seeing a happy place
mhm,
that's contrived through media.
mhm.
So I think that's very challenging for the new mums of today.
Yeah, completely agree. I think comparison is very detrimental, especially when it's around a subject such as becoming a new parent, because that is the time when you feel most judgmental upon yourself for things not going in the way that it's portrayed on social media, on within that minute clip that you've touched on that might be on TikTok, where everything looks amazing and perfect, but you don't see what goes on behind the scenes. And that's where having the right support comes in. So it doesn't mean about us necessarily having all the answers, but it's about being present with the woman and the family and to listen without judgment. And that's our role as midwives, to encourage rest, to encourage self care, to encourage connection to your family, to your baby. And especially for partners' roles, is reminding the partner that seeking help is a sign of strength, not weakness. And sometimes saying, I can see that you're struggling and I'm here. It's the most healing thing of all. And the greater family can also help massively by regularly checking in. So, just offering practical help, such as meals or childcare. I used to say to parents, if anyone's coming around to see you at home after having your baby, they have to come with offering something, you
I
know?
say that to all the
Yeah.
parents.
They're
I
going to do the washing up, they're going to do the washing, they're going to help
bring a
take
meal.
bring a meal, or they're going to take your baby for 20 minutes or half an hour while you
They
go
can
off and
have a
have a
shower and do
bath.
your hair.
Yeah, makes such a difference.
It does make a difference because time is something you haven't got when you've got a newborn. The days just roll into one,
Mm.
and that can be quite of a struggle as well.
Yeah.
So, the importance of early intervention. So, Lauren, it does sound like that early intervention does make a huge difference,
Mm.
and we've seen it firsthand. Part of our midwifery training, we do a massive piece on mental health
Yeah.
and the importance of mental health during
Mm.
pregnancy.
Yeah, it makes a huge difference. So we know that when there are perinatal mental health challenges, when they're recognised early, we have better outcomes. So it doesn't affect just mum; it affects your baby. It affects the family as a whole, and this is why it's so important. And according to research over the years, such as NICE and NHS reports, we know that time and time again, timely intervention and support, such as counselling or medication, and sometimes specialist referrals, can reduce long term complications, continue to promote a healthy family and a healthy environment, um, improving your recovery.
Absolutely. And that's why we are going to offer a free consultation with yourself through British Care.
Mhm.
They can have the consultation in the first trimester or their second trimester or their third trimester or after they've had their baby. They just need to see what stage they're at. Early's better than late. So if you can have the consultation in your first trimester, that is perfect. If you've missed that, it doesn't matter. We can do it in the second or the third. If you've already had your baby and you're struggling, you will still get that free consultation. So you can contact me and I will give you Lauren's details at British Care on 058 590 4943. Please, please, please do not struggle in silence. Anybody that needs any help, the midwives at British Care, our doors always open. So, closing and reflections, Lauren. This has been such a beautiful and honest discussion. Before we wrap up, what message would you like to leave for all parents?
Thank you, Julie. I really appreciate us having this conversation today and going through such a complex, also into quite an intimate topic for many women. And I'd just like to say that if you're struggling, it doesn't mean that you're failing. It means that you're human. And pregnancy and parenthood are an incredible, incredible journey. They bring amazing abundance of joy, but it also brings a lot of deep challenges. So, the most powerful thing you can do for yourself and your family is to reach out and to speak up, because let someone walk beside you. So, for parents or friends, family, just keep checking in. So, sometimes the most powerful and meaningful support comes from simply asking, how are you really?
Thank you, Lauren. It's been absolutely wonderful. And thank you, everyone, for listening. Remember, if anything we've discussed today resonates with you, reach out to us. We are here to hold your hand and guide you through pregnancy, parenthood, and everything else that comes with it. You are not alone and help is available. Please, please, please Do not suffer in silence. We'll leave some useful links and resources in the episode notes, including information from NICE, NHS, Every Mind Matters, and the Pandas Foundation for perinatal mental health and support. Take care, and we'll see you next time. And have a wonderful day. Please, please, if anything we have discussed hits a chord with you, please, please reach out. We're here.